Will work with Namibia to close the existing gaps in the health system. The American government will spend about $68 million in staffing and improving the healthcare centers in the next 3 years.
The clinic in Rundu's Safari suburb has more than 700 antiretroviral treatment patients on its books. Sister Anastasia Seremo, who is in charge of the clinic, says staff shortage and poor ventilation at the often overcrowded clinic are among its challenges. And this is where the U.S. government, through its President's Emergency Plan for AIDS Relief in Africa, PEPFAR, wants to provide relief.
What that will mean for all of you, and what is really useful for me to see these facilities, is that we're going to be trying to identify the staffing and facility gaps, where you don't have enough people, where the building isn't big enough, some of the more distant rural clinics where there's no place for the nurses to live. So part of the scale-up will include improvement of the facilities, expansion of the facilities so that you have the space that you need to do the work you do.
Doughton says he was happy that the country's health system is already strong with basic facilities in place and committed health professionals. He believes the recruitment of more nurses and other health workers could strengthen the system, especially in the areas of HIV/AIDS diagnosis and care.
We reached agreement with the Ministry of Health just a couple of months ago, right before the end of the year, to begin a scale-up of identification of HIV-positive individuals who don't know they're positive, and also of people who have been lost to care, to put them on ART. We're going to be, over the next 2 to 3 years, we're going to be helping the Ministry of Health to expand the effort to identify HIV-positive individuals and put them on ART as part of an effort to get Namibia to the 90-90-90 goals set by UNAIDS.
The ambassador notes that emphasis must be placed on identifying more infected people and placed under ART care. He praised the Namibian government for being one of the few countries that have made significant strides in the fight against the pandemic.